Yeah, the triage pathways is just an interesting concept that our practice has utilized for a number of years now. And it's basically the concept of being able to use scripted symptom management pathways that are evidence-based and approved by our physician board, that as patients are calling into the office, no matter where they're calling in from, they call into a centralized phone bank to talk to a certified triage nurse, and that nurse can go through a scripted protocol, and from that we can make a determination on whether the patient just needs a prescription called in over the phone, or whether maybe they need to come into the office and get some hydration and antiemetics or get evaluated in the office, or whether or not it's a true emergency to where they actually need to go to the emergency room or the hospital to get emergent care taken care of. And so that's part of the process that we have involved. With the experience that we've had in the past, we worked with Lee Newcomer with United Health, and we did an Episodes of Care project with them starting back in 2009. And one of the things that we did with that was to optimize early on ways of managing our patients to try to keep them out of the emergency rooms in the hospitals. And the positive results with that study with United Healthcare as a private payer was that we had substantial cost savings with them, and it wasn't with tight control of managing drugs in Episodes of Care, but most of the savings for United Healthcare came from us more efficiently managing the patients and keeping them out of the hospitals and the emergency rooms. And then shortly after that, our practice got engaged with Barbara McEnany's Come Home oncology medical home program, where we established a community-based oncology medical home program. And there's numerous elements with that, including the use of triage pathways. And Barbara McEnany also just recently published the results of her study that showed that the triage pathways methodology was effective in keeping people out of the emergency room in hospitals. So that showed some cost savings with the government entity, with Medicare also. And so our practice worked with a company called Navigating Cancer, who does a great job of establishing the tools that we need in order to develop these electronic pathways and scripted pathways and have them communicate and incorporate into our electronic health record all those triage tickets that occur with all the phone calls. And so we've developed a platform with Navigating Cancer, and that's proved to be very successful in our practice. And so as we got that improved in our practice, we expanded that, and we rolled that out to another sister practice in QCCA, and that's the Northwest Medical Specialties Group with Sibel Blau's group in Tacoma, Washington. And so they incorporated that same triage pathway system. Now let me emphasize that triage pathways goes way beyond just incorporating a scripted triage pathways where our nurses handle the phones, but it actually involves a large dose of practice transformation to where you have to, in many ways, turn your practice upside down to accommodate those patients. So you have to centralize your phone banks. You have to open up slots in your clinic schedule to be able to work in people during the day and at the end of the day. You have to have slots in your chemo chairs to handle those sick people that come in at the end of the day. You have to expand your office hours into the evenings and even onto the weekends. So there's a lot of practice transformation that occurs in order to successfully carry out the utilization of these triage pathways. But under that structure of utilizing the Navigating Cancer based triage pathway system that we developed, and we rolled it out to Northwest Medical Specialties Group also, we recently showed in publication that just recently came out this month in the Journal of Oncology Practice with Ron Barclay as the primary author, that we showed that our two practices had substantial cost savings shown in the OCM data that's out there. And our two practices saved Medicare millions of dollars by keeping people out of the emergency room and hospital. So I think the Triage Pathways platform is something that is important when we look at value-based care. And currently through Quality Cancer Care Alliance, we are rolling that out, and we have expanded that out to 11 of our 19 practices so far. And I'm looking forward to looking at that data, analyzing that data, and hopefully having subsequent publications that I hope will show that this can be plugged into many different practices in many different states and many different practice environments and get those same kind of outcomes.